So today, let's open up a toolbox. But we're not talking about hammers and wrenches. This is the Health Intervention Toolbox, and it is absolutely packed with proven strategies to help us understand, improve, and take control of our own well-being.
Have you ever felt totally stuck? Dealing with stress that just won't quit, or a nagging pain, or maybe a habit you just can't seem to kick? It happens to all of us. But the good news is, there are actual, concrete tools out there designed to help. The trick is just knowing what they are and how they work.
So here's our roadmap for today. First, we're going to define what a health intervention even is. Then, we'll start digging through our toolbox, looking at the medical tools from psychiatry, the psychological tools of psychotherapy, and some really cool mind-body techniques. And to wrap it all up, we'll talk about the single most important part, the relationship you have with the person helping you use these tools.
Okay, first things first. Before we start pulling out these different tools, what are we even talking about? What exactly is a health intervention?
Now that sounds pretty academic, right? But all it really means is any action you take that's aimed at a positive health change. It's a huge umbrella. It could be something big like starting a new medication, or a public health campaign about quitting smoking, or even something as simple as adjusting your desk chair to help your back.
So when you boil it all down, these interventions are really trying to create change in three main areas. We're trying to change our behaviors, the things we do. We're trying to change our cognitive factors, that's our thoughts and our beliefs, and sometimes we're even trying to change our environment, the places and people around us that affect our health.
All right, let's pop open the first tray in our toolbox. We're talking about the medical tools. This is the world of psychiatry and, of course, medication.
So psychiatry is a specific branch of medicine. This is key. A psychiatrist is a medical doctor. They're an expert in mental health, but they're trained to look at the whole picture, both the mental and the physical side of an issue.
And because they're medical doctors, this is where their training really shines. They can prescribe medications that work on the nervous system in very specific ways. You've probably heard of some of these categories, right? Antidepressants, stimulants for conditions like ADHD, mood stabilizers. Each one is a specialized tool designed to help manage symptoms by working with the underlying brain chemistry.
Okay, this is a big one that trips a lot of people up, so let's clear it up. A psychiatrist is a medical doctor, an MD who can prescribe medication. A psychologist, on the other hand, usually has a graduate degree, like a PhD, and they treat mental health conditions using psychotherapy or talk therapy. Now, a psychiatrist can also do therapy, but their unique tool is that ability to prescribe and manage the medical side of things.
All right, let's put the medical tools aside for a moment and look at a different but just as powerful set of tools, the psychological ones, all centered around psychotherapy.
You've heard it called talk therapy, and at its heart, that's exactly what it is. It's a structured, collaborative process, a conversation between a trained therapist and a client. It could be one-on-one, with your family, in a group, and it could be short-term for a specific issue or last for years, depending on what you need.
And this really gets to the core of it. Therapy isn't just aimless chatting. It's goal-oriented. The whole point is to help manage those symptoms that are causing distress so that you can function better and live your life more fully. It's a very targeted tool.
Now, one of the biggest names in the therapy world is cognitive behavioral therapy, or CBT. This little diagram here, the cognitive triangle, it shows the entire idea in a nutshell. It says that our thoughts, our feelings, and our behaviors are all connected. They all influence each other. So if you can change one, you can start to change the others.
So how does that actually work? Well, you and the therapist basically become a team. First, you pinpoint the specific thoughts that pop up in a tough situation. Next, you put those thoughts on trial. You challenge them. Are they actually 100% true? Then, together, you come up with new ways to think and act. And finally, you track your progress to see what's working. It's a very active, hands-on approach.
Okay, so we've covered the medical and the psychological tools. Now we're moving into a really fascinating area that goes beyond just talking and thinking. We're looking at tools that directly tap into the body's physical responses. Have you ever wished you had a dashboard for your own body so you could see what's going on inside in real time? Well, that's basically what biofeedback is. It uses sensors to give you immediate information, or feedback, about things you can't normally feel, like muscle tension or your heart rate, so you can actually learn to control them. Let me give you a super clear example. Let's say you get tension headaches. With EMG biofeedback, a therapist might put little sensors on your neck or shoulder muscles. You'd see a number or a graph on a screen showing your tension level.
Then, as you practice a relaxation technique, you can literally watch that number go down. That immediate feedback teaches your brain exactly what to do to release that tension. How cool is that?
And biofeedback is just one of these mind-body tools. There are others that are just as powerful. You've got meditation, which is all about creating a state of deep rest. There's hypnosis, which uses focused suggestion for things like pain relief. And autogenic training, which combines mental imagery and self-hypnosis. They all operate on the same amazing principle. You can use your mind to consciously change your body's physical state.
So, we've got this amazing toolbox full of medical tools, psychological tools, and physiological tools. But here's the thing, a tool is only as good as the person who helps you use it. And that brings us to the final, and maybe the most important piece of the puzzle, the relationship between you and your healthcare provider.
Think about it. Your doctor or your therapist isn't just there to give you information. They are your partner, your guide. They are active agents who are there to help you navigate the path to better health and make real changes.
You'll sometimes hear this word compliance or maybe adherence. All it means is, does a patient actually follow the treatment plan? Because you can have the most brilliant plan in the world, but if it's not followed, it's useless. And one of the biggest things that influences whether someone sticks with the plan is having a strong, trusting relationship with their practitioner.
And that leads right into patient satisfaction. And this isn't some fluffy, feel-good metric. It's a really important measurement of the quality of care. When you feel heard, when you feel respected, when you feel like you're part of the decision-making process, you're not just more satisfied, you're actually more likely to have better health results.
So a truly skilled practitioner is like a coach and a detective all in one. They're trying to figure out if you're ready to make a change. They're identifying what might get in your way or what might help you succeed. They're tailoring the plan specifically to you, not just using a one-size-fits-all approach. And they're there to help you handle the emotional ups and downs along the way.
So what's the big takeaway here? It's that knowing your options is power. This toolbox is available to you. Understanding these tools, the medications, the therapies, the mind-body techniques, it empowers you to be an active participant in your own health. And it all starts with just asking questions. So I'll leave you with this. What's one question you're going to ask at your next health appointment?